It'd give us the other idea, Gianna, because it was looking so foggy on the Golden Gate Bridge, but it's coming. And the current heat wave that we're talking about for the weekend can pose a health hazard. And that's especially true for people with pre-existing heart disease. So joining us now is Dr. Seema Pursani. She specializes in cardiology and lifestyle medicine at Kaiser Permanente. It's based in Santa Clara. It's a good place to be over the next 2 days for this exact topic. First of all, good morning, Dr. Pursani. And when we talk about this from the meteorology community, we know that heat, everybody thinks of floods or tornadoes or hurricanes as the biggest risk to people, but it is heat that actually takes more lives from a weather perspective than anything else, especially people who already have pre-existing conditions for cardiovascular disease. Can you lend a little insight for us on what to be aware of as we head into this weekend?
Yeah, sure. Good morning, Darren. Thanks so much for having me. So you're absolutely right. These extremes of weather, especially these heat waves, are associated, unfortunately, with more hospitalizations and even higher mortality from chronic conditions like cardiovascular disease. So people specifically with certain types of heart disease, congestive heart failure, heart rhythm disturbances, heart attacks in the past, they are unfortunately at higher risk for complications from the heat because they have less reserve, and often they even may be on medications like diuretics that make it even harder for the body to respond to higher temperatures. It's really important for everybody to be aware of signs of heat exhaustion. So those signs include headache, dry mouth, dizziness, confusion, and even heart pounding. If these symptoms are persisting, even after you're resting, you're hydrating up, getting in a cool environment, then I would recommend seeking urgent medical attention. And of course, if you are experiencing chest pain or you've passed out, please call the emergency line to get care.
I think we probably can't clarify those symptoms enough, because we talk a lot about the difference between, well, you might have heat exhaustion, in which case you still have time. You can get into the shade or go hydrate. But if you get some of the symptoms of heat stroke, at that point, it is time to call 911. And it seems kind of broad brush for so many of the symptoms. Can you tell me where that line is? How does somebody know, oh, this is heat exhaustion, I'm good, I'm just going to go inside in the air conditioning, or no, this is heat stroke and you need to do more than that?
Yeah, that's a fine line. Certainly, the first thing to do is, find a cool environment. So if you have air conditioning at home, great. If not, there are plenty of community centers, indoor locations like shopping plazas that do have air conditioning reliably. So get in a cool environment first. And if you're still feeling those symptoms that I mentioned, even after getting into a cool environment, even after having a large glass of water, sitting down, then I would be worried about you and think about seeking urgent medical attention.
Okay, I know it seems like we make a big deal when these heat waves come up and everybody's like they're overdoing it. The numbers go up. It's measurable during heat waves like this, and oftentimes it doesn't get noticed. It is a significant health concern. So thank you for helping us educate people on this, Dr. Seema Pursani. We're going to be right back after this.